Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, 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 you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide tools, resources, courses, videos, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I look forward to working with each of you. But I always like to give a disclaimer before I get into any of my content, just simply because a reminder that there's no absolute in medicine, right? We treat on a patient by patient basis, and any questions that I provide are based on the guidelines that are currently being tested on the ANCC as well as AANP exam. Now, if I am doing any videos or teaching you on current practice guidelines, I will say that in any of my material so that there's no confusion, okay? So, with that being said, let's get into question number 1 for today. A patient is in the office today and has been newly diagnosed with syphilis. Based on this diagnosis, what other screening should be completed at this time? Is it A, HIV, B, assess skin for additional dermatologic disorders, C, pneumonia, or D, no other screenings are required? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so that you can slow down and ensure that you are answering what is even being asked in the question, right? So, stem of the question states, based on this diagnosis, what other screening should be completed at this time? So, let's take it back and see what diagnosis they have, right? So, they said this person has been newly diagnosed with syphilis. So, when you're thinking about syphilis, what other things need to be screened at that time? Is it A, HIV? Yes, HIV, and of course, the other STIs, STDs. But if there is a syphilis diagnosis, you want to make sure that you assess them and screen them for HIV, okay? Also, you want to make sure that you screen them for other um like IV insertion infections and things. Like you want to check for those hepatitis B and things of that nature, okay? So, but when in doubt, if you ever see anything that asks you about screening additional things, make sure you screen for HIV if there is a newly diagnosed syphilis diagnosis, okay? If it tells you that it's a new diagnosis, these are the other steps you need to take. All right? All right. Question number 2. All right, the nurse practitioner and NP student are discussing the location of a mitral murmur. What is the appropriate location for mitral murmurs? Is it A, apex of the heart and fifth intercostal space, B, apex of the heart and second intercostal space, C, the base of the heart and the fifth intercostal space, or D, base of the heart and the second intercostal space? Take a moment and tell me what you got in the comments. All right, stem of the question states, what is the appropriate location for mitral murmurs? All right, so when I tell y'all about murmurs, and if you struggle with murmurs, go check out my murmur videos. But I tell you guys, make sure you know systolic versus diastolic and know the location of aortic and mitral. Now, I get it. Yeah, and cardiology is my background, so I promise I get it. There's additional regions. I shouldn't say so many, but we know our pulmonic and our tricuspid and all of the things, right? But I'm telling you for testing purposes, be sure to know your systolic versus diastolic in your mitral and aortic locations, okay? So here we're talking about a mitral murmur. So you need to know where the mitral location is. So is it A, at the apex of the heart and fifth intercostal space? Yes, that's your answer, right? A, because think about it, mitral is at the fifth intercostal space, whereas aortic is at the second intercostal space, right? Aortic is at the base of the heart, whereas mitral is at the apex of the heart. So just remember those things, study it. I tell you repetition is the key of retention. So if you need to keep writing this out and reviewing that, do that so that you can easily identify these and get these questions correct. Again, check out the mitral video if you struggle with these, where I go through a breakdown. And I have the Brittany's Brilliance to kind of help you tie it all together. And then lastly, question number 3 for today. States a patient is inquiring about which Medicare plan they need to obtain for vision and dental coverage. What is the appropriate plan for the nurse practitioner to recommend? Is it A, Medicare Plan A? Is it B, Medicare Plan B, C, Medicare Plan C, or D, Medicare Plan D? That is a tongue twister when you're saying A, and yeah, it's just hard. So which one is it? Which plan? Is it plan A, plan B, plan C, or plan D for vision and dental coverage? Take a moment and tell me what you got. All right, so the stem of the question is, what is the appropriate plan for the nurse practitioner to recommend? So the patient is inquiring about Medicare plans that cover vision and dental, right? So you need to know your Medicare plans. And when we speak of non-clinical content, this is some of the things that we're referring to. So you can receive some of these on the exam, right? So is it A, Medicare Plan A? No. Medicare Plan A is just the standard, and I call it the automatic. Think A for Plan A for automatic, British Brilliance, okay? um because you automatically get this if you qualify for Medicare, right? And those qualifications are being 65 years of age or older, having a diagnosed disability that qualifies, or having end-stage renal disease, right? So you automatically get those standard coverages for your healthcare needs. Medicare Plan B, I call that the basic plan, B for basic, because you get the basic necessities like your outpatient doctor visits, your labs, certain like equipment like DME style stuff. That's Plan B. Plan C is your answer. The answer here is C, because in Plan C, I call that it's called the choice plan. So I said, C for choice, C for Plan C, but you have the choice to add these additional things, the dental and visual coverage. And I think that is crazy, because it should automatically be included, because hey, we all need dental and vision. Why do I need to choose to add that on? But hey, that's my soapbox on a whole nother day. But here, Plan C, the choice plan, is the vision and dental coverage. And then Plan D, I say think drugs, because it's prescription coverage, okay? So I hope you guys found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. If you need any of our resources, any of our review books, either the ebook or our paperback book, they will be shipped to you. This is broken down by systems in the way that I teach. Short and sweet, eliminating the fluff. We have interactive sections with each system, so that after you have reviewed it, you're able to answer short answer to kind of test your knowledge and study along. Because my thought process is, hey, read it, retain it, write it, review. You know what I'm saying? And so that gives you that option. And then in the back of the book, there are practice questions with rationales as well. So there's an ebook option and there is a paperback option, all linked in the bio. We also offer a self-paced review course that is like this, with me teaching through all of the things, all of the systems, giving you my Brittany's Brilliance and a few quizzes with each system to gauge and test your knowledge as you go along. It's self-paced, and just reach out to us if you would like to use that. It's $89.99 per month, and you can end the subscription at any time. And then our main thing we do is our one-on-one session. So if you have a particular weakness that you need assistance with, we will work on that area to make it a strength. But also our main one-on-one package is our custom package. So say you've been unsuccessful on boards, you're struggling to get back on track, right? You just really don't know how to start back, what to do differently from what you did previously. So we do a pre-test, we gauge your weaknesses, we look at your weaknesses from your previous attempt, and we structure and build a study routine for you based on the timeline that you want to review again before testing again. We gauge where you are. We work alongside with you, working system by system, looking at those weak points, looking at areas that need to be tightened up on that. And you have me to work alongside with you through those things to take you from being unsuccessful to successful. We have a 100% pass rate since 2015 on those one-on-one sessions, a 99% pass rate on all of our other courses and review material. But with all that being said, let us know. Reach out to the Nursing Studio if you need any of those things. Our telephone number is 803-400-6864, or shoot an email to the Nursing Studio, the number 1 at gmail.com. Or just continue to keep following us right here and doing these practice questions. And take notes. Write it down. Review the areas if you struggle with any of these, and just keep building. We'll be right here every day doing practice questions. As long as y'all hanging with me, I'll keep doing them with you guys. All right. Happy studying. Bye, y'all.